And with COVID cases increasing and multiple public officials testing positive, where are we in terms of the coronavirus pandemic? Will we see an influx of cases in the fall like last year? And what about back to school? There are still a lot of unanswered questions. Associate Director of Infection Prevention at Riley Children's Health, Dr. John Christensen, joining us this morning. Good morning to you, Doctor.
Good morning.
Hey, I realize you don't know specifically about President Biden, but obviously he announced that he's tested positive for COVID, but has mild symptoms and is not hospitalized. Do you think this, maybe in general, is because we have better drugs, he's fully vaccinated, or is it a matter of an individual situation?
I think it may be a combination of all the above. I think what you're seeing play with President Biden is the fact that he is vaccinated, he is boosted, and the vaccines are doing exactly what they're intended to do: keep him with a mild illness, keep him out of the hospital, and keeping him from dying.
So what are the concerns with the new COVID variant?
Well, the biggest problem with it is that it's more transmissible. So you're going to have a lot more infections in the community. And we're seeing it right now. We're seeing a surge in the community, especially among young children that perhaps escaped the Omicron infections of January. Now they're the ones who are showing up in our emergency room.
Yeah, and so I guess how does it differ from the other variants? And you just kind of mentioned it right there. What are you seeing in terms of cases and hospitalizations?
Well, if you look nationwide, hospitalizations are increasing, not at the same magnitude as we saw with Omicron in January, but the number is steadily increasing, including cases here locally. We had multiple weeks where we had no one admitted to the hospital with COVID, and yesterday we had up to about 7 children admitted to Riley.
A lot of businesses, people, we've done away with masks entirely. What's your suggestion when it comes to masks for, maybe in crowded areas? I know I was recently at IU and I know there are mandates there. Every single person was wearing a mask, but in most places you go, that is no longer the case.
Yes, and it is sad because we know as a tool to diminish the transmission of the virus, masks have been shown to be quite effective. Unfortunately, many locations have stopped using it. If you're outdoors, it's not so much of a problem, but when you're going indoors, perhaps a few of us are the only ones that are using masks.
Yeah, I'll be going on a plane here recently, and I will be wearing one. For one, I'm going to see my elderly parents, and last thing I want to do is give them something. I'm just curious about a lot of the families. They're getting ready to go back to school. There was a concern in the past about, whether mask wearing and the transmissibility of the virus. What are you thinking in that term?
Well, I think that we need to go back to square one where we were perhaps a year or two ago, where we need to look at what strategies are useful in preventing the transmission. Masks are one of them, but more important, we need to start vaccinating all those children that are still unvaccinated, because not only we need to keep them from getting sick, at the same time we need to protect the people around them, especially grandparents.
Yeah, last time I checked, I think Indiana had only about 60% of our entire population was totally vaccinated, and I don't even know if that included being boosted as well.
Yeah, and when you look at boosters, it's even lower than that. And then when you start looking at the younger age groups, the percentage of children vaccinated, for example, 5 to 11 is maybe 25%. So there's a lot of room for improvement and for vaccination, especially vaccines that have been shown to be efficacious in keeping people from getting very sick, and at the same time keeping people out of the hospital and keeping them from dying.
Dr. John Christensen, thank you for helping our viewers out this morning. I know a lot of people do appreciate it.
Thank you very much.